maintenance protocols and community um, to really help you segue through the recovery. But with the help of Ibogaine, people can make massive turnarounds and attach and embrace to life in a really profound way, much quicker than any other modality I've ever come across.
Okay, and I understand what you're saying. It's a treatment plan that's just going to open my eyes and want me to live a better life and live differently, or make me want to do that by going through the process and going through the steps and doing all that, and then also being around people that are like-minded with the same mindset of being in a better place in their lives entirely.
Alex, I couldn't have said it better myself.
Yeah.
Congratulations. That's a wonderful.
Exactly.
Yeah,
He's
yeah,
a
absolutely.
All right. Well, thank you. Thank you
All
very
right,
much.
my friends, I'm just going to start. Hello, welcome. So my name is Lakshmi Narayan, and I'm the co-founder of an organization called Awake.net. And our mission is to end addiction one Ibogaine treatment at a time. We are a 501c3 nonprofit, and we're building a 9-month journey that includes preparation and detox, the Ibogaine treatment, which would be administered in places where it's legal or decriminalized, and a long integration program. So a 9-month journey, and the Ibogaine treatment would happen somewhere, depending on how people go through their detox, somewhere the 3rd month or the 4th month of this 9-month period. And in addition to doing that, we have an online platform to create community that will over time have a local cohort, a local group, as well as international people who work with Ibogaine, because that's just the nature of what Ibogaine is. I'm just going to give you a really brief introduction to Ibogaine, because I don't know if people come in at different levels of understanding. So Ibogaine is a root bark. Ibogaine is the extract of a root bark that is called IBOGA Tabernathe, and it grows in West Central Africa and the Congo and subtropical climates. It's been used as a rite of passage by the Beatty and the Pygmies. The Pygmies discovered Ibogaine for a long time, I don't know, how long is it? Does anyone know? How long? A long time. And just a second, I have to let some people in. If anybody would be willing to volunteer to sit here and let people in, that would be really awesome. Easy.
Oh, to Lakshmi's comment there, the Beatty, they have artifacts dating back as far back as 2,000 years ago of them practicing this medicine, and probably even longer, but that part for sure.
Yeah. So anyway, so when as psychedelics have come into the mainstream with the through the clinical gateway, they have not exactly come in yet, unfortunately, as we know, but the people started calling this metaphysical affect or metaphysical journey psychospiritual. I don't much like that word. I think it's spiritual. I think it's a spiritual awakening that happens with psychedelic medicines, particularly IBOGA and Ibogaine. And addiction interruption is the first part of it, but really having a profound redemption and awakening to your true purpose in life, to your, who you are as who you are in all its profundity is what IBOGA and Ibogaine offer. So, so anyway, what we're doing is we're having these monthly talks here, and we're going to be inviting Ibogaine treatment providers, integration specialists, psychiatrists, coaches, really all the dimensions of care that something like this needs. We're going to be inviting them in here to talk about it. so we can educate the public about what Ibogaine is and start a grassroots movement to save lives, basically. So thank you very much. And if you know people in this area, please let them know about this so they can come. And with that, I'm going to pass it on to Barry Rosinoff. Oh, I'm sorry, Anders Beatty, who's the co-moderator. Anders, can you take 5 minutes?
Yeah, hi. My name's Anders Beatty, and I've been very, very privileged to work with many of the people here who are about to speak at this conference. So my origin story is that I was in addiction for many years. I really struggled with that, and I failed at every modality of recovery imaginable out there, from going to the rooms, to rehabs, to detoxes, to geographicals, to new relationships, and I failed at every single one. And then I was very, very fortunate a few years ago to come across Ibogaine, and even more fortunate to have a really forward-thinking Ibogaine provider who's actually made an appearance here tonight. So it's actually really, really lovely to say hello, Paul, and thank you so much. And I took Ibogaine, and you know, attached to a protocol of self-care and healing that has completely changed my life and has allowed me to essentially become the person I should have been before the world got its hands on me. And for the past 10 years, I studied counseling at university, and I've for the past 10 years, I've been coaching people around pre-treatment. This idea of preparing for this journey with intentionality, integrity, respect, and reverence and curiosity. My belief is that with the right preparation, it informs whether the integration is going to be proactive or reactive. And in the last 10 years, I've seen a real need for an end-to-end holistic protocol that includes, as I say, the pre-treatment, the actual work with the Ibogaine itself, a decent landing zone in an environment that is non-triggering, proper integration, maintenance protocols, and community. And that is why I'm here today, because I think everybody on the panel also sees the truth behind this end-to-end holistic protocol. So that's really my story, you know. I'd like to pass it on now. Thank you.
Whoever you want to pass it on to, Anders.
People in there do stuff. But that's what I would do. Out here.
Somebody needs to mute
Maybe
themselves.
Pilton.
No.
How about if we ask for Garyth to start now?
I'm curious about Jericho Meadows, which is out here, but I don't.
Hey, Ben, ask him.
And I know someone who lives out after. It's got like 5 kids.
Yeah,
ask them.
Somebody needs to mute themselves. Thank
I
you.
actually turned in.
So,
Is it Hilly and stuff?
I mean,
Oh, really?
yeah.
Can't the moderators mute Lakshmi or Anders? Can you mute them? Mute us all.
I'm looking to
But it's
see if I
awesome.
can-
Like he has every choice they had. He had like every kind of horror character, and they're just like he had it. So he had this great Pennywise. Yeah, Pennywise. So he is.
Hello, somebody's talking. Please mute. Okay.
Oh, hi.
Got it. Thank you.
Yeah, I'll just throw my 2 cents in there on that. I'm going into my 13th year now of working with Ibogaine. And, you know, when I started, it seemed to be a lot more about the medicine, you know, and less about aftercare. Too many people were putting all of their eggs into the Ibogaine basket. And I have to say that we started getting much better results once Anders started coming on board with us and working with our clients. you know, so it's not just the Ibogaine, you know, which was much more of a thing years ago. So, you know, I feel that the movement itself is developing. You know, now there's different aftercare places, you know, in an ideal world where we didn't have to worry about resources, then, you know, people would come and stay with us for like 2 or 3 weeks, where I can have Ibogaine coming out of their ears and then pack them off to an Ibogaine aftercare facility of some form or another, all with the assistance of somebody like Anders, you know, that can help somebody through that process. Because, you know, Ibogaine isn't a magic bullet by any means. It's something that triggers off a process of deep inquiry. And so the more that we can do as a container to hold people through that, the better. And we see much better results now over the years of now working with different integration specialists, Anders in particular. And then really, you know, making sure people understand that it's not just Ibogaine, you know, that's not just that, you know, like normally if you're going for some kind of drug recovery or something like that, it's a minimum of 90 days in most places, because it takes that long in order for you to start growing new pathways, you know, and then of course, you know, Ibogaine does that much quicker. But it's also, you know, it's important for us to do as much as we can for the person going through this process to support them as much as possible, or for them to have an understanding as well that it's not just the Ibogaine, you know. So
What
that's kind of, sorry.
Sorry. I was just going to say that what I've seen of what Anders does with pre-care, and really just it's people start to transform even before they get to the Ibogaine, and they're engaged in their own process of transformation. And that's what we're talking about with this pre-care and integration, is that it's not just a magic bullet, it's not just one journey, it's a relationship with changing your consciousness. And I think that's really an important difference in how you all approach it and how we're approaching it, as opposed to a clinical conversation about what it is. Right. So, you know, the thing that I'm curious about, or I think somebody who doesn't know anything about Ibogaine, the treatment itself, is curious about, is what happens. Like, what happens after you've done all the detox and you've done everything and you get there at the door of an Ibogaine clinic, you've just been on a plane, whatever, car. What is a person like at that point when they arrive, and what are they like when they leave? I think that's really what I would love to hear anyone, all of you, comment on.
I think it's a great question. I'm just gonna put my 2 cents in there that what happens in between is what I want to talk about. You know, it's who arrives and who leaves, but it's skipping over the perhaps very significant liminal time that the Ibogaine experience can create, and how that time is held. And that informs, you know, that informs the path forward. And so, you know, it could be so simply said, people arrive how they arrive, and that's how they're received. That's where we meet them, is where they're at. And when they're in a stable place, you know, we're already moving forward into treatment. If they tumble into the clinic at the end of a run, then a whole other protocol goes into action in terms of stabilizing them physically, getting them back to ground zero before you can even begin the treatment. So, you know, you got to meet the people where they're at. And then when they leave, you know, that's there's as many ways to leave an Ibogaine treatment as there are people. So people are going to leave, some limp out, some skip out, some cry, some have nowhere to go. Some go home with a sense that they finally are in their bodies enough to attend to everything that the addiction is squeezed out. And that's what you hope for a person, but you got to again meet them where they are when they go, and hopefully have already established, you know, an idea of the path that they're going to take, or that they have an idea what the path they're going to take. I hope that helps.
Asha, thank you so much. Yeah, that helps a lot, and it definitely sets the tone. Can you introduce yourself?
Yeah, but I don't like to talk about myself, so I'll make it brief. I used to be married to Rocky Caravelli. We had a family together, and Rocky was treated with Ibogaine in the early part of, maybe it was the late part, whatever, some year, 2002, 2003. And I first heard the medicine through him, and I heard it in the sense that he had completed his Ibogaine detox, and I didn't speak to him that day, but I spoke to him the following day. And so those early days are also like, we could spend 2 hours talking about those early days. But I remember hearing him back in his body where he had not been. He had been you could say anything, excommunicated from his own self. But within 5 minutes of talking to him, the second day after he took Ibogaine, I was like, whoa, welcome back. We have not seen you in a long time, a long, long time. And that was, you know, I was super skeptical about his going for that treatment. And so that was just the seed of how Iboga came into my life. It was about 2 years later when he gave me Ibogaine for a pernicious depression and eating disorder and, you know, general like losing of my own life. And I didn't have any clue at that point that I would be doing this. And now, like Garyth, I'm beginning year 15. So somehow it came into my family, and Rocky invited me down to Mexico to work with him. And I said, sure, I'll come for a year. And here it is 15 years later, and I'm still here.
And thank God for that.
Well, and I love the medicine. You know, I still hear it. I still hear it in my head. I still have conversations with it daily. You know, it's not a once in a while kind of interaction. You know, I take bits of medicine all the time, and we, you know, in a pie chart, Iboga takes up a huge portion of my consciousness.
Well said. Thank you, Asha. Rocky, would you like to follow?
Yeah, my name is Rocky. Asha, thank you. That was a great introduction, and reminded me of the family-like tribal nature of this medicine. Now I look at seeing all the members. If it wasn't for Garyth Moxey, who told a friend who came to me and said, I'm going to go take you to Amsterdam and eat some wood, I wouldn't be here. So I didn't even realize that Garyth was the messenger back in 2003. And when I first heard about Ibogaine, I had had a couple carpal tunnel surgery, hoping I couldn't shoot any more heroin, and eating massive amounts of pain pills that didn't do anything. But the point was, is that then the name had been entered up, it was uploaded into my consciousness, and took about 10 months with a full-blown heroin methamphetamine habit to finally make my way down to a clinic in Tijuana. And so that was in 2003, and there was probably, it was all wives' tales. There wasn't any data. There wasn't any, Howard had created a kind of a sideline protocol of 5 milligrams per kilo with 45 minutes later at 10. You know, that was sufficient when I was on 80 milligrams of methadone, but that wasn't like a well-tolerated dose for everybody. So I got to watch for a year working at this clinic, and watching the same protocol over and over and over again, and started seeing how things could be improved. In 2006, I had taken Ibogaine 3 times over 8-month periods. So Ibogaine is really about, the experience is 10% of it, and then what unfolds happens over the next 7 months to 8 months. And on the third session, I met Beatty, and IBOGA told me that it was time for me to open a clinic. And so gave me a long list of what to look for. And in 2006 in San Pancho, we opened the first Awakening in the Dream House, which was based on a philosophy for integration group work by Paul Levy, author in Portland, that had Awaken in the Dream groups. And several members of that, including Matt and Rika, who are with us again this round, came down and helped us to open that first clinic. And we really didn't have a lot of information on how to administer Ibogaine or how to prepare people, or I mean, it was ground zero, because we were all basically addicts that had taken Ibogaine and got, I guess, kind of struck by lightning. I see a couple others here on that have gone through that same experience, and it entered our hearts. And so that's kind of been my mission, is to try to reassemble some of our family and tribe and try to get people protected, so that this lineage of practice and the way that we administer Ibogaine in its holistic and kind of complete way, I would want to describe it to some extent, and unify so that in the changing times with so many clinics coming to Mexico, that there's a lineage that people can turn to, that that can rely on safe practice. So thank you.
Thank you, Rocky.
Clap, clap,
so-
clap, 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 clap. Sorry, this is Rachel on safe practice. Thank you, Rocky and Asha, all you guys.
Hi, Rachel. Barry, would you like to go next? We can't hear you. Unmute yourself. Unmute. Okay.
Hi, so I was just saying that I'm expressing some gratitude to you. You've put together something here where we not only have a chance to make a contribution, but can absorb some information to advance the whole process. But you know, and I'm really happy to hear Rocky mention that word lineage, as he and I are pretty much part of the same lineage, coming from Howard. In the 1970s, I was living in New York City as a book editor, and had a tangential relationship with Howard, actually Howard and with Norma. And so I was looking over the shoulder of all of his efforts, and really feeling pretty confused about it, but intrigued. It took me quite a while until I had an opportunity to try Ibogaine myself. Now, I was dealing with a bit of a problem with freebasing, but mostly I was living very much involved in a Buddhist meditation community. And so the development of mindfulness and awareness was very much a part of what I was doing in terms of my relationship with various psychoactive medicines. And the Ibogaine opened my eyes, and I'm not going to bore you with particulars, to some really fundamental elements in my own life that were really not in my better interest or the better interest of the people in my midst. So I had this experience, and felt even to this day that that first administration of Ibogaine has directed a lot of the momentum in my life. It'll be 19 years in next week that I'll have been in Mexico. And when I moved here to Mexico, we were very much involved with the Huicholes doing peyote ceremonies, and a group of my friends here, 6 to be precise, learned that I had both access to Ibogaine, mostly through a individual who invited me to the first Gita conference, Richie. And one by one, I got instructions from people abroad and was able to administer to these 6 individuals, all of whom individually had a wonderful experience. Now, it was much more of a spiritual experience at that time. And then our friend Richie began to ask me if I would treat some people that he wanted to send here. And with him looking over my shoulders, and kudos to Rocky, I had people behind me who had vastly more experience than I had. In fact, I was really a neophyte. But so it slowly grew. And again, that word lineage, I feel that what Howard presented and then what has been happening is an evolution of understanding of this medicine. We were brave enough to start dealing with some people who had heroin addiction. And as was already expressed in this discussion, we really didn't focus on the aftercare and the pre-care. And it became very evident very quickly that, one, we do not accept somebody to come here unless they are hungry to do it. We did a couple of interventions and they were absolutely horrible. They led only to resentment. So, without talking about our specific protocols at this point, we are definitely very interested and dedicated to making sure that people are properly prepared. But, that's a very difficult element that we need a lot more discussion about, because very few people are really willing to come in and commit their 9 months or 3 months or whatever. However, if somebody is coming in for addiction interruption, we will not accept them as patients unless they have an aftercare plan of some kind. And the element that's brought to the fore here by Anders is really, he's the paragon of pre-care and guidance. And we have been looking for how we can get people to commit to going through the process of a few months of integration prior to coming. And I have been having difficulty selling that. But I guess, to encapsulate the whole thing, we are adamant about having connection, including psychotherapeutic connection with patients before they arrive. And to repeat, we will not accept addiction interruption patients without a plan for aftercare. And fortunately, we're in the proximity of a extremely good aftercare center called Inscape Recovery. They're only an hour and a half from here. And the element that they provide that is, I have never found another aftercare center that can actually have people on their staff who understand Ibogaine and can have Ibogaine with them that is at Inscape for instances of severe pause, and particularly people coming off of fentanyl, even after they have weaned off of it for at least 5-6 days, gone through the Ibogaine process, they still can experience degrees of withdrawal. So I'm just trying to encapsulate kind of what our process looks like and my engagement with it, which I just must, include the fact that it really has helped me so very much in terms of having a dedication to making the world a little bit better place, one person at a time.
Thank you so much, Barry. I went to visit Rocky and Asha and Barry. Jack and I, my Awake co-founder and I, we went to visit them, and really, it's really important to check out the clinics that you're going to work with and make sure you resonate with them and see how they do it. There's no amount of blog posts and things like that that can make up for that. But this educational kind of thing that we're creating, hopefully we can get the word out about how to do it safely. So Garyth, can you, you haven't shared yet, have you? Can you introduce yourself briefly and talk
Yeah,
about?
sorry, I was carrying on there a little bit from what Anders was saying. So a little bit about myself. I was gonna ask Rocky to be my sponsor when we were both in AA, and this goes back a really long time ago, because I haven't been in AA for 24 years or something like that. I didn't do so well in AA. I have some issues with the whole Judeo-Christian thing. It wasn't really my thing. So I was kind of bouncing in and out of AA. You know, I'd be in for 3 months or 6 months and then disappear for 6 months and then come back, and people are like, oh, hey, we've been waiting for you, kind of thing. So it was this thing that, and things were getting progressively worse and worse. I took LSD, and I recovered from my alcohol use order with LSD, and that's kind of what set me off on this path. And as I was studying all about psychedelic recovery, that's when I stumbled across Ibogaine, and then and I had gotten wind that Rocky had a relapse, and that's when I said to our mutual friend, Rocky really needs to go and do Ibogaine. You know, that's what's gonna help him there in that situation. And then through our mutual friend, I was hearing about Rocky's treatment and what happened afterwards, and how much, as Asha said, you know, he was back, so to speak, as you know, the guy that we all knew. And so at that point I was like, oh, well, I'm going to go to Canada and open an Ibogaine clinic, because Ibogaine was legal in Canada then. And so I was within about a week of going to Canada to try and start this, and I met my ex-wife at a Burning Man party in San Francisco, and everything got put on the back burner for quite some time. But anyhow, I was going to Britain to visit my daughter, who I hadn't seen since she was 2.5. And she was now 25, 26. And I had 2 grandchildren. So that was, we'd been reunited through the internet and stuff. And just prior to me going to do that, to go to see her, I was working in construction. I was a painter. And I just developed really, really bad back pain. And I had a bunch of baseboards to do. So I went and got T3s from the doctor. And, you know, I since realized that back pain was all, you know, emotionally driven. So I had an opiate relapse like the week before I went to Britain. I started with T3s, and within 2 days I was booty bumping Dilaudid. And I hadn't been physically addicted to opiates for a really long time, like over like 10 or 12 years or something like that. So when I was going to Britain, so I maintained opiate use until I got there, and then I did a DIY in my friend's pop-up caravan. I took way too much iboga than I should have done, and quite frankly, I should have died when you look at the numbers and everything, but I didn't. And you know, through the whole journey, it was kind of like, you know, the medicine had spoken to me. For a long time, I'd really wanted to work with people in addiction. You know, I wasn't about start giving LSD to people with alcohol use disorder, which is something I do now on occasion. So that just kind of catapulted me into the world of Ibogaine. And before I contacted Richie. Richie's coming up again you know, and Richie had found some people for me to contact in Mexico. And so I did the Ibogaine, the IBOGA in August of 2011, and by 2012, March 2012, I was helping out a clinic in Mexico. And then there was the Ibogaine Providers Conference in 2012 in Vancouver, and that's kind of, you know, I kind of met that lineage, you know, so I started working. I had a lot of help from Claire in the beginning, Claire Wilkins, you know, and that's still that lineage. So yeah, and that's how it started. And I met somebody else at that conference, and then we started an Ibogaine clinic, which we were very busy for the first couple of years. I got completely overextended and found out what my limits were and how to cross them, and then what happens to you when you cross them. So since that clinic, you know, we started Inner Realms about 10 years ago or something like that, or 9 years ago, and so we've been operating Inner Realms ever since. And that's kind of my story into Ibogaine and how I'm here now. And it's funny how there's these connections, you know, that go back a long way and stuff. So anyhow, I'm very happy to be here. Thank you for having me. That's my 2 cents.
Thank you, Garyth. We have Patrick and Michelle Fishley here, and I'd like to invite you to share too about your work with Ibogaine, or however you want to share it.
So hey, I'm Patrick. That's my wife, Michelle. We're part of Soul Reflections, and that's a company we have. Hey, Garyth. I remember you way back in the day.
With whom it all began.
Yeah, so I mean, my whole thing with this whole plant started way back when Garyth and someone else said, hey, let's open a clinic in Canada. And so I came on as the nurse, and I'm a critical care nurse, and you know, didn't know anything about this thing, what it did, other than the fact, you know, understanding what it does, interrupting addictions. And I mean, I did a lot of, as much as I could at the time, homework on what this thing was and what happens with it, and we need to watch out just for a safety part of you, because you brought me on for a safety person, and to this day, that's number one. If it's not going to be safe, let's wait. Let's pump the brakes. Let's come in and save only in the same space. So I started working there for a while, and it was, yeah, the place was busy. It was good. We saw a lot of good outcomes. We saw where you could have things better too, because as you're always seeing, you're always developing and developing ways. Then a few years after we were working with them, we were actually sharing a space with another provider, and he asked me to come and like be the nurse person for a very traditional IBOGA ceremony of a whole bunch of counselors, addiction counselors, doctors, nurses, etc. So I did that, and I saw this whole other side of it, which there is, you know, in Ibogaine, you know, it's really amazing at interruption of addiction, and any kind of addiction is really good at that. But when I saw this, and it has some psychospiritual to it as well, and it really does well, I saw the full medicine of IBOGA, and I was just knew I was there. So since then, you know, my wife's always come with me when she can, and then she started coming full time because someone had to work. You know, we had all these kids at home. We got 6 kids. Oh my goodness, she were both nurses. So we started working with that, and then we did tons and tons of addictions ceremonies and retreats. You know, I was working with IBOGA Soul at the time, and it's where we did the dosed and things like that, and really stretched the limits and found the limits. And then all of a sudden we saw the inclusion of all these carfentanyls and benzodiazepines, and it's like, yeah, this is not where IBOGA wants to go anymore. For the whole plant, there's so many alkaloids, there's so many variables. you know, so, you know, we stopped doing like addictions, although now we still work with them, but we have people come in a better way so they're ready to receive the medicine. Or if they can't wait, I ship them to Garyth or whoever's got a clinic that deals with that more on that way there. But
more fine-tunedly.
yeah, but you know, the one thing that I love about this whole medicine, it doesn't take your choice away. I mean, it shows you what you need to see to move through, to heal, to repair, to do whatever you need to do. It will show you that every freaking time. It'll show up. Are you going to show up? That's the thing. Because people think, oh yeah, I can show up. Oh yeah. And it's like, they're like, oh, I don't want to see that. Oh. And it's like, but that's what it is. And it's the choice. And we need to make that choice. And that's why preparation, integration is like, it's everything. And people really put a little work into preparation. You know, I always say that they show up like Kramer walking through a door, you know, on Seinfeld. It's like, oh, that's how you're going to meet it. That's how it's going to meet you. So anyways, yeah, we just love the medicine. And yeah, we go to Africa quite often and do lots of initiations and learning from our elders and then supporting folks like these here who are doing amazing work as well. We'd love to be part of this. So thanks for inviting us. Bessie.
Thanks for coming. Michelle, do you have a word?
Oh, I just thank you for Lakshmi for putting this together, this beautiful community of people to share what we know and to celebrate, you know, the complexity of life, which is, I think, you know, what this is about, isn't it? It's about growing and evolving and finding ways to be in the world. So thank you so much. We are very happy to be here.
Yeah, me too. So I would like to open up this topic about the cardiac risk of Ibogaine and talk to all of you about what you've been able to do to mitigate that risk in your treatments. So for those who don't know, Ibogaine slows down the QT interval, IBOGA and Ibogaine, but Ibogaine HCl particularly, I guess it slows down the QT interval between heartbeats. So if you have any cardiac issues like arrhythmia or other things, or you have certain substances in your system, we don't know enough about what goes on with fentanyl, et cetera, but it poses a significant cardiac risk. And so recently there was a death at there was a death at 2 clinics. One clinic that had all the fibrillators and the doctors, they had everything, but still the person passed. In the other clinic, it was somewhat negligent, something happened. But the fact is, so people will bring this up as a reason why Ibogaine is a dangerous medicine. But the fact is, one person dies every 8 minutes of overdose. So if you look at the danger of that versus the danger of maybe 1 in 300 in terms of someone dying, Ibogaine is really, it's the medical dysregulation of it that creates the problem of Ibogaine being unsafe. So what we're doing here is we're not waiting for the governments and the systems to do the right thing. We're doing the right thing, and we're creating these protocols. We're going to make them public. We're going to create an incentive for people to want to join us and make it safe. So, so anyone who wants to start to talk about that issue.
I'll quickly hop on because Michelle will be here, but I have to hop out. We're in the middle of a retreat still.
Yeah, it's for her massage.
She's in her massage, so I have to go pretty quick to get her. You know, it boils down with when you're starting, it's pre-screening is super important. You can't skip on the blood work. There's certain components in that blood work you need to have that show how your whole system is working. You get a really good idea of the working process of this amazing machine. And then there's like EKG. And you know, it needs to be looked at by the doctor or cardiologist who can sign on it. The one thing I've known from working critical care and everything else, 'cause I can read them too, but we, on certain things like insulin and other things, we always have two people read it. That way it's legally, it's a lot safer. And, you know, we do watch for the QT, and a little on EKG, there's a little spit out at the top that tells you what everything's going on. And it's about 75% accurate. And so this is a medicine of truth. and knowing, and you need to know. And you can mitigate risks like this. You know, having someone who understands the body medically and critically, you can foresee things before they happen. So it's really having qualified people helping and working together, brainstorming a good care team helps mitigate a lot of these risks on things.
There was recently a Stanford study that I'm sure you're all familiar with Nolan Williams, and he's been using a protocol with magnesium. And I'm not quite sure about that, but rather than take a risk, we're now making sure, well, actually, we've been doing it for quite a while. We give people mineral supplements, but we're beginning to administer more of the magnesium along with the Ibogaine before, during, and after. And hopefully that information from Nolan Williams and his group has some efficacy to it. I can't really vouch for it, but I'd rather be safe than sorry.
So I'd like to talk a little bit about this same topic, Barry. Back in 2005 and 6, I had 3 clients on day 3, all 50 years or older. All had been on methadone for 25 to 30 years. One was on 3,800 milligrams of morphine. And on day 3, they tapped out on electrolytes. And we had they stopped breathing. Luckily, they were quickly brought back and got them to the hospital and asked what was the problem. They said one was low on potassium, 2 were low on magnesium. So since 2006, we've been building supplement packets for 3 days prior to treatment, along with a modified diet. Also taking into consideration any other kind of medication that they've been taking, because medications mixing with Ibogaine can be so contradictive. And so there's so many ways that there can be a cardiac event, even after the screening and getting a clear picture on where they're at in that moment, what we can do to support that. This is how some of the changes in how we do like an opiate detox, if we're going to isolate that specifically, and break it down into parts rather than doing what we used to do, which is once you started a treatment, you went all the way through. And that's when we used to treat methadone directly, 170, 180 milligram tolerances for long periods of time, and it would go on for days. And it would be really, really hard. It's really interesting. As much as Ibogaine has risk factors, I've also seen how resilient people are. So, you know, in the last 20 years, we've been able to narrow down all of these different categories of, you know, what they receive in food upon arrival for 3 days, making sure that everything they came with is gone, making sure their bowels are moving, because if people have impacted bowels and take Ibogaine, that's a cardiac, that can create cardiac events. And so some of these aspects are not just clean EKG, making sure they got magnesium, but there's a package that we try to build for 3 days as a minimum. That's when people fly in, that we take to prepare in order to be able to feel comfortable and safe enough to give anybody Ibogaine. We're never in a hurry to give anybody Ibogaine. That's like whatever code. If something doesn't look right, if they haven't slept full night's sleep, if they haven't been stabilized, if they haven't been able to restore their energy, if they're coming in depleted in any manner, all of those things have to be addressed. And when you start dealing with a solid somebody who's basically rested without fear, stabilized on something to keep them comfortable so they can sleep and eat and function normally. And you do that for 3 days prior to treatment. We don't see any cardiac crisis. It's interesting, we've been monitoring the difference between Iboga, Ibogaine, TA, and how they affect cardiac rhythms with people. Some people are hypersensitive to it, and you'll see it right away. You'll see a drop in 10 points in their pulse rate, especially if they're pre-bradycardic, which is 55 or lower, which is not uncommon to see coming in. We'll accept people at 50 beats per minute and monitor them through the treatment. There's a couple of things you can do to bring people's heart rates up, but we're monitoring them through the entire treatment. It's not like we give them Ibogaine and say, okay, we'll be back in 12 hours. We're there with them through the entire process, monitoring them. I think that the biggest and most of the cardiac events or fatalities associated with Ibogaine, at least half of them have been with other combinations of drugs on board, either before, during, or after. Iboga does not like to be mixed with stuff. It really doesn't like stimulants. It'll tolerate alcohol up to a certain point, but Iboga is very dominating. It's very possessive when it comes into your body. It doesn't want to be in competition with food. It doesn't want to be in competition with any other compounds. For whatever reason, it tolerates opiates and it tolerates benzodiazepines, which is very helpful in a lot of cases, but it won't treat the benzodiazepine tolerance. But I'd just like to say that there is a safe way to prepare somebody. And if in the screening you see something that isn't right, like ischemias, which is common in stimulant users, they can damage and kill parts of their heart muscle. Those things have to really be taken into consideration. So anyway, a little bit on our point of view.
Thank you, Rocky. As always, so knowledgeable. So Garyth, I'm very curious about the ramp up slow dose protocol that you and Blair have developed. Could you speak a little bit about that?
Yeah, well, it's just a low dose protocol where we're just basically titrating people off of morphine. Here in Canada, our situation has changed a lot. When we first started this, somebody with a $100 a day habit might be 400 or 500 milligrams of morphine. Now a $50 a day habit might be 2,000 milligrams of morphine once we get them switched over, or we get them into if we can get them onto safe supply. So our whole situation in the kind of the pool of people that we can work with has changed a lot. We used to work with people in a much more desperate situation that they would show up on the door on heroin. But now it's not like that. So many people are using crystal meth. Because how heavy fentanyl is. So a lot of street people are using crystal meth the way we might use lattes. Do you know what I mean? Need a little pick me up, and it's almost like it's kind of like they're not even really doing it. Do you know what I mean? Oh yeah, and there's that little bit of side that I'm doing as well. So the whole situation has changed up here, and now also with the benzo thing and everything like that. So for a lot of the opiate people, we're not flood dosing them just because their opiates are up too high. And this was something that through the help of Claire, when I was operating I was the provider at Liberty Route, there were people that, with their EKGs or whatever, we wouldn't have been able to flood dose them. And she helped and guided me through that process of working with morphine and Ibogaine, which is, I think, Rocky, you had a lot to do with the development of that in the beginning. And in our community, it was always like, oh, you can't ever mix Ibogaine and opiates together. Well, actually you can. And they go together very, very well. So, it was more about, and actually, even when we were still doing flood dosing, we'd do a couple of days or 2 or 3 days of lower dosing. And so we weren't crashing up against, 1,000 milligrams of morphine or something. We'd spend 2 or 3 days bringing that dose down. So that's working in a lower dose with Ibogaine. And then I still do that with everybody I work with, even if it's, psychospiritual, I'll do the day before, of an inquiry dose. You know, we can see how somebody's going to receive the medicine, how it's going to change, you know, and also their sensitivities. There's a wide range of sensitivities with people to Ibogaine. And so I don't think you need to ram too much into somebody at all. And in fact, you know, when people are overly sensitive to Ibogaine, they might not even remember the experience if you flood dose them. You know, so then, and that was another thing as well, that we found that in the beginning, about 20% of the people that we flood dosed wouldn't remember anything. You know, because we're going quite high and stuff, and it's like, you know, doing too much MDMA on the dance floor. You know, you had a good time between midnight and 4 a.m., but you don't remember any of it. You know, so anyhow, getting back to working slowly with people, I'd worked with some people that had had treatments before, and they had done flood dosing before. And then they did this slow protocol over a week to 10 days and came out of the other end saying, dude, I feel way better than I did the first time I did Ibogaine. You know, or that was a much better treatment. And so I was paying attention to that, because I'm not overly convinced that, you know, flood dosing is the way to go. And I think that in the future, if, you know, if the medical establishment do embrace Ibogaine, it will be in a much more slow and regulated way, particularly if we're dealing with opiates. You know, the medical establishment doesn't like tripping, full stop. And if they could find a way of working with something like Ibogaine in a much slower way, then I think it's going to be much more appealing to the medical establishment as a whole, if there's less risk. You know, I know it's ridiculous when we think about somebody dying every 8 minutes in the States, and then they're saying, oh, this is risky, you know, but at the same time, I don't think anybody should die because they want to go to recovery, you know, so
So I have a
yeah,
question.
just working slowly with Ibogaine, just by working that way by default, people end up with a lot more Ibogaine in them. And I find that I'm more interested in the amount of nor-Ibogaine that somebody gets in them and the path that they follow after treatment. You know, and their work that they're doing with a therapist and some kind of aftercare. And also we work with 5-MeO DMT, which is incredibly useful at the end of a treatment. You know, a lot of people in addiction, you know, all they do is berate and talk to themselves like shit, and they have absolutely no self-love. And that can be changed in a very short period of time. So, you know, I just think of it as safety profile, particularly with the opiate people. We flood those people that aren't opiate dependent, and I still will flood people if they're on a lower dose, you know, but with the opiate people, I still keep them for a long time. And I have found over the years that 50 milligram per kilogram, you get that much Ibogaine into somebody and they've got Ibogaine coming out of their ears, that really sets them up on a physical way to be able to walk through this. I'll give you an example. Last November, sorry, 2 Novembers, we had a guy come for Ibogaine. He was a film producer from LA. He'd gone to Mexico and done 2 flood doses and relapsed after both of them. He was using a lot of dope. Well, you know, by the time I got him switched to morphine, it was like almost 2,000 milligrams of morphine. But he stayed with us for a month. And that what he went through and how he was catapulted out of our care and how his life totally changed. And I think that was more to do with the fact that he was working with Anders, and that he considered a lot of planning himself and taking time off work afterwards, because that's what he was doing before, was just rushing back in. But he had the treatment that worked, and he'd gone to Mexico twice and it hadn't worked. And I really feel that's just because he hadn't received enough Ibogaine, because he got home dragging his feet 2 weeks later, and you know, that's kind of how a lot of people relapse, you know. So I'm much more for low dosing after a flood dose, prior to a flood dose, bring somebody into a range where the Ibogaine is going to work much better. It's not smashing up against a huge wall of 1,500 milligrams of morphine or something like that, you know. So it's just a different way of working with people, and I found it to be as good as a flood dose or better than, quite honestly, you know, if you've got all of the moving parts in place. So I found that the flood dosing with people that are on very high doses, it's too much like pulling the rug from beneath people's feet. So that's my 2 cents on that. Thank you.
Can I just add to this? I mean, the efficacy of a saturation protocol or an incremental club protocol where you put a lot more Ibogaine into somebody and that they're walking away with more Ibogaine. The particular client that Garyth is talking about, he is kind of like a central aspect of my aftercare for anybody who's coming in and doing Ibogaine from California. The first person I will send a client to is to go and have a coffee with this particular client, just in order to see the efficacy of an Ibogaine treatment where people have put the right integrity into it and taken authorship of the journey. And I think this is incredibly important to say. I'm not doing pre-treatment and aftercare in order to tell the client what to do. It is really about them taking authorship and sovereignty of the journey they're on. Because when people take authorship and sovereignty of the journey, they want to keep it. If they hand it over to a third party, well, we're addicts. We're going to rebel. So this is one of the most important things about this particular journey with Ibogaine. It is a monomythic journey. It is the individual's journey, and people like me and Garyth or Barry or Rocky, we walk a part of the path with them, but we encourage the client to take authorship and sovereignty. I think that's a really, really important thing to say. You know, it requires the client, as I always say, authorship equals freedom. That's my 2 bits worth.
Well said. Anyone else want to say? Barry, you look like you. I think you have to unmute. I did it. No, you have.
Lakshmi, can you speak into the thingy bob?
Sorry,
It's very
I
difficult.
was just asking Barry to unmute. Sorry.
I don't know how I got muted. I guess you did that. But
Yeah.
I just wanted to go back with something with Garyth when he's talking about opiates. What opiates are you seeing there in Canada? In terms of pharmaceutical grade short-acting opiates, we see once in a while we're seeing it now. It used to be prevalent, but that's almost off the charts. Are you still seeing a lot of that?
Through our medical system. We have the rapid access addiction clinics here. If you're testing hot for anything like fentanyl, you can walk in there and they will throw you a handful of Dilaudid, and then you get to go. And so instead of methadone and Suboxone, there's a daily pickup of morphine. And so they come in forms of Cadian, which is 100 milligrams time release. And so what they'll do is they'll give you a handful of Dilly 8s, and then you go to the pharmacy every day and your morphine goes up and up and up. The same as it would with methadone, you know, how they increase your dose every day, but you're given the Dilaudid. And so because the morphine is a tough switch for a lot of people, so some people have got they're on a prescription of a certain amount of Dilly 8s a day, which they can bang. And then there's the you know, the morphine back there to, you know, hold as a kind of stable dose. But you know, I spoke to a guy on the phone the other day that's on 3,000 milligrams of Cadian, a handful of Dilaudid, and he's still using a bit of street dope on top, which is just insane, you know. But
Right.
that's
Well,
what fentanyl's doing, you know. So
yeah, but it's a an advantage that you have there in in Canada that the
Yeah.
doctors will write a prescription for a short-acting opiate. I
Yeah.
mean, it's like pulling teeth in the United States, or harder than that, wisdom teeth.
Yeah, totally. You know, occasionally we have somebody that we work with that can switch people over from very small amounts of sub, you know, but so yeah, otherwise it's everybody's hands are kind of tied, you know, and yeah. So the morphine situation, you know, I'm lucky because I can get oodles of morphine up here because there's so much of it being diverted out onto the street and stuff, which is a good thing as well, because some of the people that we work with, that's where they get their drug supply off the street. They get dilaudid and they get morphine because they don't want to go to the doctor. They don't want to get labeled. So fortunately, we have a lot of safe narcotics circulating out on the streets, you know. So
Wow, congratulations.
yeah, I know it's we're very
I
happy
wish
about
you-
that. But now we're just going into a local election where the Conservatives might get in. So they have promised to do an end to how we're encouraging drug use out here on the west coast of Canada, which is just fucking bullshit.
So it's not Canada-wide, it's mostly on the West Coast
Yeah,
that the doctors
they
will
can get that. Well, because we live in a very, you know, progressive. In some ways, we're an extension of San Francisco up here.
Right.
So it's still West Coast, you know. Whereas we're next to Alberta, which is like Texas of the North, where they kicked everybody off safe supply.
I'd also like to bring up the subject of the 5-MeO. Having you know, my own experience with it, it's a wonderful feeling. I mean, you get a sense of the separation of mind and spirit, or body and spirit. And obviously, after people do a flood dose of Ibogaine, the 5-MeO is going to make them feel great. But does it actually contribute to the detox process?
Yeah, I think so. I feel that there's a synergy that happens between Ibogaine and 5-MeO. And so I feel that people are in a better place going out the door with both of those substances within their system, quite frankly.
I see.
You know? Just because of a shift of perception.
I've resisted it. I've resisted it. I felt, at least at first, when it started coming across with Crossroads and some other places, that it was more of a gimmick than anything else. And we've stayed with a protocol of doing a good booster dose of Ibogaine, and the preponderance of our patients leave here feeling with what they call the IBOGA glow. Which in some ways is similar to the 5-MeO. And so we have felt that the additional Ibogaine would create more noribogaine and give them a better opportunity going forward.
Yeah.
Yeah.
Well, we do both.
Uh-huh.
You know, people have got Ibogaine coming out of their ears normally by the time they leave us, especially if it's been an opiate detox. You know, so, you know, and I'm normally sending people off with boosters as well, you know, if I can. So
we do that as well. And the other thing that we're now incorporating is that we have a microdosing program for former patients. And that we're only into the 3rd month of it, but the results have been exemplary.
Right. Yeah, well, just trickling more of the noribogaine in to keep those levels up, you know, it just extends that clarity or that addiction interruption that people are experiencing. So, but with the 5-MeO, no, I personally feel that I feel better results because there's that connection, deeper connection that people have with themselves, and a sense of forgiveness as well, or a sense of self-love. So it's that element that I find, you know, incorporating that into the end of treatment. And I didn't first start doing it. It was really something that we started doing it in a realm. So I didn't really do it at Liberty Route, you know. So yeah, and I'm doing it because I'm seeing better results.
Okay, well, proof of the pudding.
Yeah.
It seems like some people don't have a visionary experience with the HCl, right? So then the 5-MeO satisfies that desire to have a altered state experience. right? Because it's pretty reliable with 5-MeO that you're going to have a opening happen. So
Yeah, but that's also not always, unicorns and rainbows. It can be very difficult for people. And we also, the way that we work with 5-MeO is also the way we work with everything. We like never throw anybody in the deep pool, in the deep end of the pool. We always start in very shallow waters and then move slowly into deeper waters. So we don't do like they do with Bufo, one shot, kaboom. We don't do that, often because we work with the pure molecules. Sometimes we'll start with insufflation, and so they're in that experience for almost an hour before they slowly start vaporizing. So some of our 5-MeO sessions can have lasted up to 3 hours for one session, which feels quite different from the way it's been served in most of the clinics in Mexico with Bufo, which is really just kaboom, and that's it, so.
yeah, I didn't realize that you could do it in a slow, over 3-hour period of time.
Yeah, well, most of them aren't, but with insufflation, they're often 2 hours because we do 4 rounds of vaporizing, and then added with the insufflation, which is normally about an hour. So it's often 2 hours or just a little bit over. Yeah.
Does anybody in the audience have questions? Anyone? Can you come up here so that, or do you mind? It's being recorded if you don't want to be on the video.
So my question is, are any of you treating patients with chronic severe pain who are on long-term opiate use and using very low doses of Ibogaine on a daily basis to suppress their tolerance? Not to get them off of the drug, but simply to get them down on a reasonable dose, and so they are not complaining of pain.
Did you all hear that?
Yeah, I was going to say, I'll touch that. There's a lot of cases where opiates stop being effective regardless of how much you take. So just like anything, there's a window of effectiveness, especially when you're dealing with pain, because your intention for taking the medication is different than, like, say, doing heroin or fentanyl to get high. You're using it as a medication for management in a medical guideline or supervision. The good news about using Ibogaine to reduce people's tolerances is so they don't have to take as much morphine but still get the same relief, and how that impacts the body on a physical level. Because if you take too many opiates, it has a lot of other side effects that can affect the body and make it difficult to feel okay and function. So if you can take somebody from 300 milligrams, say, of Oxycontin and bring them down to 60 or 80 and still get the same results, that's a really wonderful thing to be able to provide for someone. And there's been many cases where we've had people that wanted to do psychospiritual, but they were on Suboxone. And it was like, well, don't worry, it's just going to go right past the opiate receptors. It's not even going to deal with them. And so there's a wide range. And I'd like to talk about that, how many different ways of utilizing this medicine compared to a standardized protocol. And standardized protocols keep everything within a safe realm, but working with each individual according to what their desired outcome and what their intention for wanting to receive medicine for is really what our job is, and when it comes down. And I think that that's the lineage that we were talking about. We all know this medicine personally and have gone through a lot of these same processes ourselves, myself included. And so it's been really helpful and effective to learn how to be able to meet somebody where they're at, and not have an opinion one way or the other of what they're asking for, but what can we do to help improve the quality of their life? Yeah.
I'm sure that you've noticed, you and Garrett and Patrick, but we've had numerous situations through the years where people would be coming in here to treat one thing, and find that they had other elements going on, pains in their legs and tremors and various things, that they were just surprised to find, hey, my foot doesn't hurt anymore. We're beginning to categorize those, to collect them from each individual. But there's just so much we don't know about this medicine.
Thanks, Barry. Can you speak about what happens during the active phase of the Ibogaine treatment for addiction interruption, not so much the psychospiritual? So that's one question that I have. If you can talk about it on whatever level, body, mind, spirit, just what happens? How does the Ibogaine work in your brain, in your consciousness? Just what's exactly going on?
Are you asking me specifically?
Anyone who wants
Yeah,
to.
I would defer to Rocky on it, but yeah, I'm gonna pass on that question.
So I like this topic. So number one, Ibogaine is not a psychedelic. It's an onophrenic or dream creator, which means that your unconscious and your subconscious are open while you're awake. Another drug that does this is heroin or opiates. They're onophrenic. That's why they're friendly towards each other. I don't think that Iboga and opiates have a beef with each other, because in some ways there's some very strong similarities in how their characteristics are expressed. The thing is, with a nod, when you come out of a nod, you never remember it, and so it draws you back in. That's the opiate. With Iboga, if you take the proper dose, you'll remember everything. So anyway, that's part of what is happening is while you're under the influence of this, is your subconscious and unconscious are releasing information into your conscious mind. And so this is where people talk about having an experience of seeing different periods of life that they've lived, whether their childhood. I have never seen moments of my childhood, but I have seen when I'm going to die. I've watched my children grow up in my arms, and so there's some kind of unlocking or letting go of information out of the unconscious and subconscious. The other thing that's happening is that the Ibogaine is vibrating the cells all throughout the body. When you take Ibogaine, it's very physical. You feel it moving through your body, even staying in certain places, working on nerves, like Barry was talking. We've been tracking neuropathic pain and how it actually is opening the nerve channels and relieving pain, especially with like, oh, I'm trying to think of the disease. Anyway, we're getting a log of data for people that have nerve pain type experiences. But this vibration of the cells is where the trauma from our lifetime is stored. So memory is not stored in the body. It's stored, or not just stored in the mind, it's stored all throughout the body. And there's this description of bubbles coming from a pot. And as those bubbles come up into our consciousness, they pop and then we see them. And so we're going through files and files and files. That's why coming out of an Ibogaine treatment, there's a quietness of the mind. There's like a sense that we've offloaded all this baggage. Some of it we've reviewed. Sometimes people sleep through the whole treatment, which is kind of unusual, but it's typical for stimulant users. And it will still have gone through these files and released a lot of that weight that we've been carrying around. And so, whether you're dreaming or not, or whether you're just basically getting the medicine in the body, these things are happening, simultaneously. The other thing that's happening is when you hit a certain threshold dose, I normally use 7 milligrams per kilogram or more of hydrochloride, you're breaking the most available neural pathways of obsessive and compulsive mind thoughts or loops that we've created as a way of how we want to feel. The brain, when exposed to drugs, you get this, I feel good when this happens. And the brain goes, okay, well, I'll make more pathways and deliver more neurotransmitters to that center of the mind to achieve this same feeling. Once those pathways are in, they're basically imprinted into the brain. So when taking Ibogaine and you're breaking that neural network, you're literally returning back to before the drugs had created those pathways. That's the Ibogaine treatment. And I'm so glad that we've been talking about nor-Ibogaine, because without a proper noribogaine foundation, we can't regrow new ones so that the body can feel good on its own. That's the glow that we've been talking about. So all of a sudden the body, this all happens very fast. This same process will happen if you cold turkey. It just takes months and months and months and months. With Ibogaine, what's happening is it's repairing itself so rapidly that you're starting to be able to feel good again within a short period of time. And so, you know, those I guess, 4 aspects: communication with the unconscious and subconscious while you're awake. And that's why these low dose protocols are so effective, because it's reopening that and letting people revisit that over and over and over again, rather than trying to pack it all into 1 or 2 sessions. And I think it's more important that people have more time, because IBOGA is the therapist. We're not. We just create the container and the space and anything that people need in order to have a safe treatment. But IBOGA and the individual are working all their stuff out. And so as much time as we can create for them to be able to return to that place and keep picking up where they left off and keep following through with their own process of what needs to be looked at, what needs to be discharged, what needs to be implemented into their lives. On the other side, when people are going into the gray day, people have a common complaint. Oh, I don't want to be thinking about these things. These are the reasons why I came to take this medicine. And we have to remind them, but you have IBOGA on board with you. You're discharging these thoughts, these memories, these experiences. You have somebody assisting you. This hopefully will be the last time you'll have to go through this in this manner. We're lowering the level of the charge of the trauma or the charge of the memory, which has caused us to make decisions of either self-medicating or not knowing how to deal with life the way it is. And you know, that's a long story in itself. And a lot of us, that's how we ended up using drugs, is they didn't have things for us to figure it out. And I think a lot of my own drug use was all just basically figuring out how to get along in life. It was never pointed out to me that there was something behind it all. So, you know, when we're dealing in addiction interruption, we're only dealing with the main problem. What I'd really also like to emphasize is the initiatory experience, the life, death, rebirth. That's traditional in Africa, you know, especially with the youngsters 17, 16, 18 years old, is what they're doing is they're allowing to remove the projections of the outside world. That life, death, rebirth experience, regardless if we're doing an addiction intervention or not, it's kind of like coming at the problem from the side rather than head on. You heard Garyth talking about trying to hit an addiction head on that's at 2,000 milligrams of morphine. That's a train wreck. That's a collision. I don't like things like collisions and floods. Those are disasters. What we're trying to do is to create an initiatory experience, and as a byproduct, these other side effects like addiction interruption and these things are taking place. But the core of the Ibogaine experience should be more about the life, death, rebirth initiation, is what we like to call it. And in that process, you're addressing all these other issues. So I don't know if that's a quick summary, but somebody could build off that.
Mm-hmm. Well,
that was pretty wonderful. Thank you.
I would like to comment about the some people feeling like they didn't have any experience. And, you know, our protocol is we still do flood very often, most of the time, although sometimes we spread it out over many hours. But what we have found too is that when our protocol has a booster dose 3 days later, an awful lot of the material that was not easily recognized from the flood experience does come back into focus.
So I just want to mention here that what Rocky was saying about the Ibogaine is the addiction interruption, and that's kind of the beginning of the journey for the initiate. And we, the IBOGA, the initiatory ceremony, right now there's a separation between this initiatory ceremony happening with the Beatty, etc., and the medical addiction interruption. In my view, there is no separation between these two things. We are on an initiatory journey through life, And when you take substances like entheogens, they compress everything, and you're able to see things in that compression that you could not see in the long term. Like you were saying, the booster dose does that. Well, for me, over 300 journeys that I've done, lots of very big journeys with many substances, I've seen that you're really on a journey through life, and it's the evolution of your consciousness, the evolution of your personality and your soul. That's what life is. And entheogens, particularly iboga, these are the medicines that have been given to us as spiritual nutrition. And it's unfortunate that we are in a culture where you have to become a spiritual criminal in order to be able to take this medicine. So there's a lot of education to be done about initiation and the journey of altering your consciousness. Sorry, it's a little bit of a side note from the Ibogaine journey, but I feel like in the context of it is appropriate.
I mean, I always look at my addiction as, you know, I'm incredibly lucky and proud that I was able to work with Ibogaine and other plant medicines in order to find out who I was in many ways. I think the most, you know, for me, I'm at a place now that I look at my addiction and my 25 years in addiction. I look at that as no more than a taxi that brought me to a place where I could do this work. And in many ways, I'm incredibly grateful to my addiction because it was the vehicle that brought me to a place where I could do this deep and meaningful work and not be lost anymore. So that's one thing to add. I just wanted to add to Rocky's eloquence there. I often look at the Ibogaine experience as a massive defragmentation. You know, you're, you know, if we can consider ourselves to be a really amazing computer that maybe because of a bit of childhood trauma or some, you know, other things going on, we've got a little bit of bad coding in us. And I think Ibogaine is the opportunity to have a defragmentation of the files that we don't need anymore, that are getting in our way. And once we've done this Ibogaine experience, it's almost as if we've been put back to factory settings in many ways. It's what you do in the 3 to 4 to 5 to 6 months after. What programs are you going to put into place? What antiviral software are you going to be putting into place? And a lot of that is about what habits, what rituals are you going to connect to that are imbued with self-compassion and understanding and kindness. Ibogaine gives us the opportunity to exchange bad ritual for good ritual. And yeah, it is very complicated in many ways, but yeah, I think that's all I've got to say. Sorry.
It's also archetypal, that journey of, I'd love to talk a little bit about that if anybody is inspired.
Well, I think I think I would like to say one thing. You know, the last 2 to 3 generations are the last 2 to 3 generations which haven't had a monomythic journey of some type. We haven't had some grand gesture that we attach to escape childhood and become a man or a woman in some way. And so for me, I look at the Ibogaine journey as an opportunity to attach to a hero's journey, a rite of passage. If you look at the last 40 to 50 years, many of us don't have that opportunity to connect to something really, really, really profound, especially within the Western cultural paradigm. So maybe in many ways that, working with Ibogaine is our opportunity to have that monomythic journey and find out who we are on our terms.
Anyone else in the Zoom audience? Hey, Jack, do you have my glasses?
Yeah, I agree completely about the archetypal nature of it. It's very fascinating. And regarding I want to tie two things together: addiction and also people PTSD. I think that often PTSD can be looked at neurologically like a type of addiction, just of neural pathways that are easily triggered and cycled through. I missed the first 30 minutes of this, so sorry if this was covered. But yeah, the way the PTSD purges and defragments, and you experience it all, but with this anti-trauma effect on the nervous system, is really fascinating. And once you surrender to the process and you kind of know that you're seeing this stuff for the last time, it it makes it easier to kind of just be with it. And one of the without getting too far into my personal stuff, one of the last flood doses I had, I confronted a lot of stuff of religious programming and imagery from Catholic school about hell and stuff like that. And it was an extremely unpleasant journey until I realized finally what was going on, and that it was just purging years worth of this stuff. And it's funny because archetypally, the Iboga spirit, if you want to call it that, it often presents itself as a personality or a spirit or something, whether it's really just an aspect of yourself, like a dream character. And it's funny because it actually, I've worked with Iboga a few times, and it's always been a very benevolent spirit. But this trip, it decided to kind of like confront this health thing.
You're muted.
I got a phone call. And I was like, haha, I'm really the devil. And it really freaked me out for a little while, for a couple hours. And then by the end of the trip, it kind of took that mask off and was like, haha, got you. But now you're over this and you processed it, and years worth of just deep subconscious stuff. So I've heard it called a master cinematographer. And I really find that to be the case.
Beautiful. Ian has if anyone goes to awake.net, it's called Flood of Fire, and he's written an article about his last Iboga journey. Very powerful account, I would say. It's worth reading. It's quite long.
Yeah, it's
So
about 15 pages,
why
but
don't you tell us? Why don't you tell us some more about what happened in that journey? Because that was a really profound and powerful experience. I think anyone would get something out of it. So we have time if you'd like to go into it a little bit more.
Sure, I'll share a couple details. It was a pretty high dose experience, and the trip lasted for 2 days. And the report took me another 2 days to write, and it was about 15 pages. So I'm not going to get into all of it, but a couple of the interesting highlights were uh, I had this various intentions of what I wanted to look at, just a psycho-spiritual growth experience. And relationship stuff, like a history with my mom, and just different things. And one of the most profound healing moments that happened in the beginning of it was these spirits and these angels appeared. I had Weety elders surrounding the bed, and it was very fascinating. They were working on my heart, working on my head, and just doing different things. And then they finally all flew away, and this angel floated by and like looked into flew by my head and said, the answers, or look within yourself for the answer you seek. And I was wearing a full eye mask at the time, so couldn't see anything in the room, but I could still see my hands in front of I could see the room around me, just like astral vision. And I was like, okay, sure. So I looked down at my chest and I noticed my heart, and I could see this shard of blue glass sticking out of my heart. Couldn't even believe it. I reached down and I was able to pull it out and hold it in front of me and turn it over and analyze it. And like I could see the shape exactly of it, and just turned it to dust and it floated away. And that was one of the most profound symbolic things. And it's hard to even tie down exactly what that meant, but I think it was something to do with like this final aspect of healing. You know, it wasn't like the Iboga or the spirit or whatever were doing all of the healing. They left the final detail of it up to me because it was always my choice. And what that represented, it's hard to say. I have theories. I've spoken with a Jungian psychologist about it, and we have ideas. But regardless, that moment was just one of the most beautiful moments. And I actually had a mild arrhythmia for years before that experience, just a very mild. The cardiologist cleared me and I was fine. But that arrhythmia was associated with a breathing problem, with a breathing pattern. And after that Iboga experience, I haven't had that arrhythmia at all, which is interesting. And one more thing I'll share about it is, yeah, all of my little intentions for what I wanted to analyze with this trip were taken care of within the first 20 minutes of the trip in a very direct way. Iboga was like, oh, you think that's a problem? Nope. All right. And then it just moved out. And then it showed me this whole journey of the universe, like the creation of the universe, all these different planes of existence, heaven, the spirit world, earth, everything in between. And then the trip shifted to this very hell-oriented experience where I was forced to see visions of hell in the Catholic sense. And yeah, it was very disturbing. I thought it was one of the most traumatic things I had ever experienced at the time. And until I realized the next day that it was actually purging me of this trauma. Because in my humble opinion, you know, at first grade, if they tell, it was an HCL experience, Libby. If you know, they tell you as a little kid, cat is spelled CAT, you know, 2 + 2 = 4. And if you sin, you're gonna spend eternity burning in fire. You know, that's what they tell a lot of little kids. And it's just like, even if you process that emotionally, intellectually, you've got these deep patterns inside you that so I had this really brutal experience. And by the end of it, the next day, I went and sat outside, and I was sitting just staring at the trees, and I began to realize that I was just feeling better. I was feeling good. I was feeling free of all this stuff. And then a funny thing, I don't know if other people have noticed this, but the visions, they seem to be really strong at night. And then during the day, they become less so. It's very odd, but I ended up, I wasn't really having visions at the time. So I laid down on the couch and then closed my eyes, and I started to see these whirls of smoke moving up through the air. And the way the scenes were unfolding for me is a small detail would be like visible, and then the kind of camera would pan out and show this bigger, like well directed scene. And so I saw this wisp of smoke, and I was like, oh man, I'm gonna have to see more visions of fire. I've been staring at fire for 9 hours. Like, I don't need this. But I was like, okay, I accept this. And and the vision panned down, and there was this orange pond of water. It was made of smooth, clear water, but it was bright color, like the color of fire. And then this face came out of the water, and just this, look at that. It was a young African man. Just his face came out of the water, and he took one deep breath and sighed. He went, and then sank back into the water. And to me, it was just this beautiful symbol of making complete peace with fire in the form of water, as cooling and refreshing as water. And I just love that about Iboga, that the symbolism is just like so humorous and just brilliant. like the way that symbols are encoded into dreams. It's just like that. It's like, it's clever. And yeah, it brought me a great degree of peace. I sat and stared at the fire the rest of the night. And then just to sum up the trip, there's a lot to the trip. If you guys do want to read it, it's a very long report. The rest of the night, I saw scrub brushes scrubbing my brain, scrubbing my neurons for many more hours. And not exactly like fun, but definitely I was there for the experience. I was like grateful for it. I was like, let's get this done and purge it all. And I was so grateful to Iboga, the brilliance of that spirit, whether it's just an aspect of my own mind or whatever it is. I just it's just a genius spirit. And yeah, anyway, I'll just leave it at that. Unless...
Amen. Genius spirit indeed. As we all have, if we can only get to it. So I think that's a good place to close this meeting, unless anyone else has something to say.
I had a question. Hi, everyone. First of all, I just want to say I love the heart of this community and the love and support and the open, honest sharing that's been here, and obviously Lakshmi and everyone. But I wanted to actually ask, because the deaths were brought up that happened recently, and some possibilities in terms of, you know, different measures that can be done, you know, in terms of prevention, pre-screening, right, lower doses. I was just curious what sort of final thoughts people might have about ways we can make it safer in this space, in terms, or more consistent, because it seems like everyone has their own practice. I love the conversation about like speaking to where people are at and owning their authority, as it were, their sovereignty, their autonomy. So just any final thoughts on that, given what recently happened?
I think we have to be willing to take into account that what we say here and now is not what happens there and then. We're going to be projecting, we're going to be talking about what might happen or how to prevent something from happening. But also, I want to include what you allow to happen. When you hold space for what comes, my experience of this spirit is that it is one that does what must be done, that which we cannot do by ourselves. In the same way that we cannot scrape plaque off our teeth, we have to go to the dentist and a procedure has to go. And I think that this plant is in many ways performing spiritual surgery on people, sometimes in the removal of something sick that is there, and sometimes in the adding of something that can support the overall well-being. But we jump so fast to the result, and at least my experience is in the time when what is being asked of everybody involved, not just the person taking Ibogaine, but the entire container and everyone holding space in that container, is to disconnect from time. Because the things that you're thinking about here, you won't be thinking about there. And you know, the interaction that you have with yourself in this space is not going to be the kind of interaction that you have with yourself in that space. And it's a master level being with yourself. And time bends, and Iboga breaks rules while we're there. And I think that, you know, when you put this medicine in somebody's hand and they put it in their body, I think that a veil is dissolved between this world and the spirit world, and the spirits can come, and they don't function in these linear kinds of ways. And so we can say, you know, I looked at fire for 9 hours, but I want to just point out to the quality of the 9 hours. Again, not just for the person taking the medicine, because they're going to be fully consumed in their experience. It's like a laboring woman. There won't be anything else with a proper dose of Ibogaine. There will be nothing else except the Ibogaine. You're not going to be worried about anything outside of your immediate experience. And then for the people who are attending to you, my practice is that the attention begins and it doesn't stop, it doesn't wane, and it's a grueling amount of attention that you pay. And when you do, you find over time that, you know, Iboga has an ebb and a flow. It has an arc. It has strength of personality at all of the hours. And so talking about what Ibogaine is like, I mean, we could talk about it at hour 1 or hour 14 or hour 27 or hour 55. And it has an activity and a life, and it's, you know, I never want to say what it's like. I never want to say, because we don't control content, but we do hold space. And that's, you know, properly held and not improperly held. The medicine takes care of itself. The Ibogaine is not dangerous. Combining it, certainly the combination of Ibogaine and other substances, dangerous. The combination of Ibogaine and underlying conditions, dangerous. But if you are willing to take the time, and again, not be in a rush to give Ibogaine, then you can, that is the mitigation. It's not what you need to do to mitigate, that is the mitigation. And also working with the intention as a facilitator to bring someone into the stream of consciousness with the medicine. So I know that the world is really involved in dosage and dosing protocols, but there's quality of experience that needs to be taken into account. And you can learn how sensitive a person is based on an introduction. I think Garyth used the word, another word for it, but a small dose of medicine, and you can observe, which is what we as facilitators are there to do. We're there to observe what happens, because you won't be observing yourself from the outside. You're so completely involved in your subjective experience. And that's part of what we could, you know, perhaps talk about at another point as well, is what we observe and what a person is subjectively experiencing. And they're both really important in understanding, because I think people want to know what's going to happen. And it's an impossible question to answer, except that you can talk about what you observe happening with another person when you've seen it happen to a lot of people. When you've been there for a lot of sessions and you've sat bedside for a lot of hours, you can answer those questions, but it has to be a delicate and nuanced conversation, and the space has to be held for that.
Thank you. I love the answer.
Thanks, Asha. I'd like to wrap up, and if each of you could just talk about, just, you know, say who you are or how to reach you. I will, yeah, if you could just quickly say what your website is and your phone number, perhaps, because this is going to be on social media as well.
I'll start and then also finish at the same time. So my name is Asha Caravelli. Our website is www.awakeninginthedream.com. My contact information is on that website.
Someone want to go next?
Yeah, Awakening in a Dream. We're located in the state of Guanajuato, in a town called San Miguel de Allende, which is a sweet neutral. They call it the gem of Mexico. It's kind of like Barcelona on a hill. And this has been our new home, and you know, where we're getting our licensing. So we're a legally operating business in Mexico, which I think is important to be able to achieve in these times with all these influx of new clinics. And so thanks, Asha.
So I'm Barry Rosinoff, and IBOGA Quest, that's IBOGA plus Quest.com. And our contact information is also available on our website. We're located in a place called Tepoztlan, which is about an hour and a half south of the Mexico City airport, up in the mountains. And we have a very beautiful set and setting here, surrounded by mountains. And I think it contributes a lot to the whole feeling that is projected at IBOGA Quest. Thank you very much, everybody.
Garrett,
Hi.
you're on mute.
Am I on mute still?
Oh, sorry, is that me? Oh, sorry, Anders, you go ahead, mate.
Can you hear me?
Yes.
Okay. Yeah, my name is Anders Beatty. I'm on www.ibogainecoaching.com. I've also included my phone number below. Please feel free to get in touch. I'll always shoot the breeze with anyone about Ibogaine and pre-treatment and integration. It's what I've been put on this earth to do. It's my calling. And I'd just like to thank everybody, seeing Rocky and Barry and Asha and Garyth and Paul Featherston in the audience and ads and a whole load of people here. What a privilege to be working in Ibogaine, and what a privilege to be working with you people as well. And Lakshmi, thank you so much for putting this on. Yeah, and please feel free to get in touch and shoot the breeze. Thank you.
You're muted.
Good evening. Can you hear me?
Yes.
Yeah.
Okay, yeah. So like Anders said, everything Anders said, and I'm Garyth Moxey. I run innerrealmcenter.com with Blair Bromley, and we are in Vancouver. And so I don't have a telephone number, but we can be found through our website. And yeah, thanks everybody, all you guys, for being here. And yeah, thank you so much, Lakshmi, Jack.
Can I just add quickly? I've got a horrible feeling that I might not mention Garyth's name in that list of luminaries, and this is the man I work with the most, and so I just want him to know that he's loved by me. And if I forgot his name there, that was a horrible, horrible mistake to make. But Garyth, thank you, mate.
Thanks, Anders.
My name is Lakshmi Narayan, and I can be found on awake.net, which is a platform. Please join. If you're an integration provider or an Ibogaine person, please join the community. And if anybody from the Ibogaine world wants to put on an event one of these months or be a part of an event that we're putting on, please reach out, because this is a grassroots movement, and I think we have to kind of build it, or it's like building a well of knowledge, of education, of outreach, of community, and we're just getting started. So thank you very much, everyone.
Thank you, Lakshmi.
I'm going to sign off now. Goodbye.
Bye.
Okay. All right. Thank you, Lakshmi.